Hello, world. A very good afternoon. Namaste and Nisam Bulavinaka from Sydney, Australia. I am Sashi Singh, and welcome to Sashi Singh's Talking Point on this very beautiful Sunday afternoon here in Sydney. Wherever you are, I hope you've settled in and you've had a big lunch, perhaps, and relax and join us for this afternoon session. Today's episode 13 of Sashi Singh's Talking Point program, we will shortly be joined by Dr. Neil Sharma, former Minister for Health in the Fiji First Government and a current medical practitioner. We will discuss with Dr. Sharma pertinent issues regarding the health services in Fiji and make an attempt to identify what are the real problems facing the nation today when it comes to providing effective health services to the people of Fiji. Lots to discuss with Dr. Sharma, including his departure from the government ranks. I hope you will find this afternoon's program interesting. As we begin, may I please request that you share the SSTP page on your own timelines so that we may share the interview with Dr. Neil Sharma with as many interested people as possible. To ensure that you receive instant notifications for all future program and for any posts that we do put on the SSTP page, please like the page and more importantly, press that follow button so you don't miss out on any news at all. So welcome again to those who've just joined us. Sit back and for the next 2 hours and a bit, relax, mother, and let's be entertained by this afternoon's program. Welcome to the Thinking People's program, Sashi Singh's Talking Point. However, before we begin this afternoon, one big kere, I have a request to make, please. And I request that if you live in Fiji, particularly in Fiji, or if you've traveled to Fiji in recent times and you have dealt with the health services in Fiji, please let me know this afternoon what your experience has been. If you have had a sick relative or you yourself have gone to the hospital in Fiji for treatment, let me know what your thoughts are in terms of the confidence you have in the health sector in Fiji, in terms of the duty of care, in terms of the readily availability of medications, etc. Let me know your thoughts. I'd love to share your thoughts via the comments column on the SSTP page. And let me also say that please keep your comments clean and do not go calling names or being nasty or going crazy. I will not tolerate any swearing or abuse of either my guests or my viewers. No profanity will be tolerated, and that is my zero tolerance on the program. So let's keep it nice, let's keep it friendly, and let's hear your comments in terms of the health services in Fiji, and hopefully we can share those with our viewers as well. Well, we begin episode 13 of the SSTP program with a warm welcome to our regular contributor, former Fiji TV journalist Nikhil Singh, to tell us of the key happenings of the political week in Fiji and in Australia. Nikhil, welcome to SSTP and a very, very good afternoon to you again.
Good afternoon, Sashi, and good afternoon to all the viewers.
Well, Nikhil, it appears the elections are only months away with an announcement from the Fijian Electoral Commission last week. What was the gist of the announcement?
Well, Sashi, before that, I think it's important to highlight that the Electoral Commission of Fiji now has got a chairperson in Mukesh Nand. The commission went without a chair following the resignation of Suresh Chandra, who was in a bit of strife, and he resigned. So the commission met last week and announced that the election campaign period will commence from the 26th of April. The campaign period will end 48 hours prior to the date of the general election, which is yet to be announced by the president of Fiji. The commission said the announcement is in accordance with the Electoral Act, and that the campaign laws will apply to all political parties, candidates, and their representatives from the 26th of April, Sashi.
Well, let me add to that. The earliest date elections can be held is the 9th of July, and the latest date that the elections have to be completed, done and dusted, would be the 9th of January 2023. So 9th of July this year to 9th of January 2023 is the period during which the election must be conducted. Well, Nikhil, an opposition party has accused the Fiji First government of abusing taxpayers' money. What has prompted this accusation?
Well, Sashi, as I've just shared the Electoral Commission's announcement, which signals the commencement of the campaign period, it is hard to ignore a sudden increase in recent weeks in the number of visits made by government ministers to schools, villages, rural and farming communities, where we have seen distribution of equipment, promises of roads being fixed, and so on. To the extent that I think in one of the budget consultation sessions, the Attorney General accepted the fact that hospitals need improvements. It's very rare for the Attorney General to come and take responsibility, accept matters of this sort. But according to a report in Fiji Village, National Federation Party leader Biman Prasad says it is utterly shameful that the Fiji First government ministers have formed a conga line behind their master, who is the Attorney General and Economy Minister, and are making a beeline for the people using valuable taxpayer funds when, for more than 3 years, they were enjoying the luxury in their ivory towers. The NFP leader has described the ministerial visits and meetings as pure electioneering and vote buying. Prasad says while the declaration of the official campaign period is 6 weeks away, the ministers have suddenly found time, energy, and resources to, I quote, scurry all over the country like squeaking, hissing, chattering rats. Prasad goes on to say that leading the conga line is the AG, and that to please him, the ministers are falling in line and dancing to their master's tune. He says the agriculture and commerce ministers are behaving like Santa Claus. No doubt, Sashi, we will see more of these visits by ministers in the coming weeks. And if you look at what's going around in the country, my money is that elections will be called very, very soon.
Well, I was going to say something about the dancing conga line, but I think I'll save that for another day. Now, Nick, the Reds, I mean, I just can't get over what Biman Prasad said. Anyway, moving on, the national minimum wage review continues to be a hot subject in Fiji. The Attorney General, responding to questions about the timing of the review, and as we know, as you've just said, it's election year. Well, the Attorney General said he couldn't do a review when the borders were shut. But the Fiji Labour Party says this is disinformation by the AG, and he needs to stop and to be honest. What do you have on this?
Well, in referring to questions on the timing of the national minimum wage review, Sashi, the Attorney General has tried to quell the argument and the claim that the review is an election gimmick. The Attorney General has said that they couldn't do a wage review earlier because of the borders being shut, and that a lot of people had lost their jobs. Now, he has been called out on this. Former Prime Minister and the Fiji Labour Party leader Mahendra Chaudhry says the AG is simply misleading the people. Chaudhry has highlighted previously that the wage review was due in 2019. Borders were not closed until April 2020. Job losses did not take place in 2019, at least not due to the pandemic. The national minimum wage was last reviewed in the July 2017 budget, effective September 2017, where it was raised from $2.32 to $2.68 an hour. The next review was due in 2019, long before the crisis caused by the pandemic hit the nation. This was not done, and that is why Chaudhry is telling the Attorney General to stop lying and stop misleading the people of Fiji.
Well, I bet you there's a lot more to be revealed as the keywords of jhoot and lasu lasu, don't throw stones if you live in a glass house, so to say. Well, Nikhil, we reported in our previous statement about the increase in the cost of flour by some 21%. There is now an application before the Fiji Competition and Consumer Commission that could potentially impact commuters.
Especially bus commuters will soon find out if they will have to fork out a few extra cents or dollars for that matter following an application by the Fiji Bus Operators Association seeking an immediate increase in bus fare. As you said, the application is with the Fiji Consumer and Competition Commission. In addition to the fare increase, bus operators are also asking the government to remove duty from fuel as a measure to provide relief. But that is for the bus operators. Such at the end of the day, any increase, and you mentioned about the increase in flour, we've seen the increase in sugar, fuel, any increase will cause more hardship for the poor. Former Reserve Bank Governor and Unity Fiji Party leader Savinathan Narumbe hasn't minced his words when talking about the poverty level. He said in a statement, as reported by Fiji Live, that 400,000 people were living in poverty and it was already rising to over 30% before the coronavirus reached Fiji. He has laid the blame squarely on the Fiji First government, saying the economy minister Ayaz Sayed Kayum's financial management is the worst in history.
Yes, I did follow that. And to say that the financial management of the country has been the worst in history, Mr. Savinathan Narumbe has not minced his words at all. Well, closer to home, Nikhil, South Australians went to the polls yesterday. Will the South Australian Premier Stephen Marshall's Liberal government be returned for a second term?
Especially the Liberal government has been defeated by Labor just after one term. Both major political parties were out to create history in this election. The incumbent Liberal government, led by Premier Stephen Marshall, was looking at becoming the first government to be returned after the pandemic. And the Labour Party, which had been in government for 16 years before losing in 2018 to Stephen Marshall, they had their sights set in making the incumbent a one term government. With a swing of just under 6% against the Liberals, voters in South Australia handed Labor a landslide victory, with Peter Malmuscus set to become the state's 47th Premier. There are 47 seats in the South Australian Parliament, such you need 24 to achieve majority, and the tally currently stands at 25 seats to Labor, 9 seats to the Liberals, and 4 to others. Now, counting is still in progress with all those pre polls and postal votes. Um, Now, the other important point out of these elections, such is while voters do make a distinction between state and federal issues, last night's results will be of a concern to Scott Morrison. I'm sure we'll have more to cover on this in the coming episodes.
Yes, interesting indeed, as we also have federal elections this year, and whether the state result has any bearings on the national outcome is something that we will have to follow very, very closely. Nikhil, once again, thank you very much for your contribution this afternoon. As always, very nicely presented. Looking forward to seeing you next week. Have a safe and blessed week, Nikhil.
Thank you, Sashi.
You are watching Sashi Singh's Talking Point on Facebook Live. We ask the questions that Fijians all over the world want answers to. Fijians want to know. Well, it's time to meet our chief guest for this afternoon. Dr. Neil Sharma is a graduate from the class of 1976 and has 43 years of clinical and health management experience. He is double specialty trained in obstetrics and gynecology and family medicine general practice. Dr. Sharma is a practicing specialist in both specialities and has obstetrics and gynecology teaching experience in New Zealand and Fiji. He has been a medical writer and correspondent, having served as the inaugural editor of the Fiji General Practitioners, spanning some 15 years. He is currently a health columnist for Fiji Plus and an intermittent opinion columnist for the Fiji Times. Dr. Sharma has published 38 articles on healthcare on the LinkedIn website. He has also produced and anchored on FBC his Wellness Issues, a 13-part series in season 1 of 2017 and 18. Dr. Sharma's research interests include aspects of healthcare and management, sixth health policy gap analysis undertaken in 2018 and 2019, and he has been the health minister in Fiji from 2009 to 2015. Currently, he is in sessional clinical practice and undertaking international relations postgraduate studies at the University of the South Pacific. He is a member of the FMDC as a private sector representative. It is now my pleasure to welcome our chief guest this afternoon, Dr. Neil Sharma. Good afternoon, Dr. Sharma, and welcome to Sashi Singh's Talking Point.
Good afternoon, Sashi, and good afternoon, listeners on Facebook. My
I
pleasure
hope
to
you
be with you today.
I hope you are well.
Fine, yes.
All right. Well, let's get right to it, Dr. Sharma. There's so much to discuss this afternoon. Now, as I do with most of my interviewees, I like to go right to the beginnings, their roots. How would you describe your early beginnings?
I'm a Suva boy, but my parents were from the burning west. Dad was from Nandariba and mom was from Latoka. And I was born in Suva, brought up. I went to Holy Trinity High Primary School, Maris Brothers High School, and subsequently was awarded an Indian government scholarship to study medicine in Amritsar, Punjab. And I returned. On my return, I worked in Suva initially, and then I was posted out to Lambasa and served the Northern Division. And subsequent to that, I came back to Suva and furthered my training in New Zealand.
All right. Well, you've more or less summed up your career partially. Let me ask you, who was an early influence in your life?
I think it was my mother. Uh, she suffered from migraine, and all
Mhm.
three siblings in our family went into studying medicine. She was a very loving person. And on the other hand, Dad was also a great person, um, likable, knowledgeable, and he's always a threat to the British colonial powers because as a student, he was found in New Zealand standing on a student platform and talking socialism, and he was banned from New Zealand for life. And he
Yes, he had
returned
to
to
come back to
Fiji.
Fiji, I believe.
Yes, and he was a chartered accountant by profession, a graduate of University of Queensland, and ended up as a member of parliament. And somewhat like me, he chucked it in. He chucked politics in within a short while after the 1987 elections when the NFP and Dove divided.
Yes, and your father, of course, the late Honorable C.P. Sharma, was a former NFP parliamentarian getting into parliament in 1977. Now, you said that you graduated from India and then became a young medical practitioner. Where was your first posting?
My first posting was at CWM Hospital when we were doing our internship, and
Well, let me
my
say for the next let me say for the next hour or so, you'll have to turn your phone off or put it on
yeah,
mute.
I do that. Yes, I worked at CWM. I was doing my internship, and then subsequent to that, there was a shortage in Lambasa, and I was sent across to Lambasa Divisional Hospital, and we served from there.
Now, Dr. Sharma, soon enough, I mean, after your graduation, after your first posting, you directly involved yourself in the arena of reproductive health in its evolving spheres over several decades, both in the public and private sector. How would you describe your personal services to the people of Fiji?
Well, we did our level best. I did my level best, and there was nothing, sort of out of the ordinary. But in obstetrics and gynae, and it was an important area. It gave us a lot of experience. and at the same time we were able to serve our communities and peoples in a very effective manner: safe childhood, family planning, contraception, cancer screening, and the whole gambit of obstetrics, which involves care of women in pregnancy, and gynecology, which is the study of women in the entirety, through from being a girl child to being and postmenopausal patient and an adult and aging person.
All right, let's look at you and politics. When did you begin to take interest in politics, and why? Why politics?
Well, you see, always was involved with medical politics. I was vice president of the Fiji Medical Association way back, and then president of the Fiji General Practitioner Association. And the leading thing was that I was editor of the medical journal, the Fiji General Practitioner, for 15 years, and we kept it running quarterly. And I ran a column, Medical Politics. So I was rather keen on seeing how politics involved and affected the delivery of healthcare.
All right, now, why Fiji First? What was it that attracted you to the Fiji First Party?
Well, in the period 2008, sort of Fiji was going through difficult times with healthcare, and I was asked by the current minister for uh, um, Minister Ayaz Kayum to join the service to improve healthcare in Fiji. And this went on repeatedly for about 6 months, and I had ambient feelings about moving to politics. However, when I looked around, there weren't enough senior people who could be able to do what they could to effect a sort of transformation in the health delivery. So in the end, I thought to myself it would be difficult for me as a person. However, I thought I was adequately groomed enough to be able to take on the challenge and, in a clinical manner, improve the health delivery in Fiji. So I was interviewed by a military council, and I was offered a position to lead the Ministry of Health at that point in time.
Dr. Sharma, we're getting some messages that your volume on your side seems to be slightly flat or low. I'm just wondering if you could just perhaps increase the volume level on your side.
I've got it at 100%.
All right, well, let's just continue and let's see. I'll try to increase mine, and I hope yeah, the volume I've increased for you on my side doesn't create a feedback. So, all right, now, how and when were you first appointed in government in Fiji?
Are you referring to my initial, sort of coming in as a young doctor, or was it
No, no, no. Sorry,
at
as
political?
we're talking politics here.
Right.
You did mention that Minister Kayum would visit you and sound you out. So the question is, when did you first get appointed? I guess
Right.
as a government a rep or a government minister.
I was appointed in January 2009, and I served till the elections in September 2014. Thereafter, I got elected on a Fiji First ticket, and I was in the parliament until April of 2015 when I resigned.
All right, we'll come to the resignation part in a while. Um, when you were appointed the Minister for Health in January 2009, what were your feelings at the time of your appointment as minister?
Well, it was there was a lot of ambience as far as I was concerned, but we needed to start thinking outside the box. We needed to be able to look at major health reform because the whole system was crumbling at that point, and it had to be a multi-pronged approach. And I followed the WHO building blocks means in which we need to have executive oversight, leadership, uh, effective workforce, and so things like health financing, supply chain of drugs and medication, and an appropriate IT system to coordinate and sort of keep an eye on monitoring and evaluation and communications effectively. So it was a multi-pronged approach, and I think we made reasonable progress because at that point, Sashi, we must realize that there were structural adjustments and being taken after the Cold War had ended, and Australia and New Zealand was pumping in a lot of finances into the Pacific prior to the end of Cold War. But now they said they needed to see what was actually happening, and there was need for monitoring and evaluation. So, keeping all that in mind, the first important issue was to move things forward in a forward direction with a lot of positivity, and that's what exactly we did.
Thank you. You are watching Sashi Singh's Talking Point, and our chief guest this afternoon is Dr. Neil Sharma, former Minister for Health in the Fiji First Government. Please share, if you can, the SST page and this interview with family and friends if you can. Don't forget to like and follow the SSTP page as well. To begin our next segment, let me start by saying health of the people is the health of the nation. Health for all must be the fundamental goal of all nations. Let us now look at Dr. Neil Sharma and the Minister for Health portfolio that you held. Now, Dr. Sharma, when you were appointed, you said that healthcare reform policy was put in place. What was the healthcare reform policy?
Well, if you look at the health reform policy, the in the region, Australia is the largest donor of funds to health. And what they do periodically, they do a health in transition, and they look at how things are progressing with their funding. And I happened to be around at that time when we were going through the second wave. And the second wave indicated that our public health endeavors and the delivery of clinical health was on target, and we were doing exceptionally well. And they did mention that it would be hard to repeat the if amount of change which has taken place during that period.
Now, what happened to the healthcare reform policy? Does it still exist, or has it been shelved in the dark dungeons of obscurity that perhaps it will not see the light of day?
Well, it's an ongoing process between any donor, international agency, or philanthropic organization and a state, and they do need to maintain it. But then things have happened. Leadership has changed. You have had leadership with people who have no idea what healthcare delivery is, and at the same time, our bureaucracy does not have a long-term development plan in Fiji anymore. If you go back, to Ratumara's time, there was always a 5-year development plan. There was medium and long-term plans. So what happens is things continued even when there was a leadership change. So really, what happens now is when there's no long-term plan, everything comes to a halt when a leader changes, and as a result, everything stalls at the level of bureaucracy. No decisions are made, and even as we talk today, we have a major pandemic, and nobody's really lived through a pandemic. So all the other items such as NCDs and communicable diseases have been put on stall. It's been sitting there, but it'll have a longer term effect, a cumulative effect. So a lot more morbidity and mortality will arise.
Now, when you became the Minister for Health, you said that establishing the recipe to right size human resource health was painstakingly slow, but had been achieved. What was this all about?
When you have health sourcing, human resource, sort of, you need to quantify what where you are, and you need to see where you should be. So what happened was we had a doctor-patient relationship of one doctor per 2,000 people. And with the restructuring, what we effected was raise the now an amount of medical graduates coming out, increase postgraduate training, so that what happens as of today, the benefit is that we are down to one doctor per thousand. So we've halved that. And we are very close now to the optimal figure WHO projects. At least, one in 800 would be a lot more ideal.
Okay, you also said that the healthcare reform process was set in motion with modernization of all relevant archaic laws and addition of necessary ones. What were these archaic laws and how did it affect the people of Fiji?
Take the example of the Public Health Act. It was developed in 1936. It has never been changed. It has never been, sort of given fresh eyes to look at in modern times in the 21st century. So these were things which were put forward, and they still haven't really amended it significantly. All we have is a few regulations. Now, that was one example which ought to have been done, and that has been sitting with the Solicitor General's office since 2013, I think. So, sort of we have completed the exercise, but it hasn't been effected. But at the same time, all the other laws were looked at, all the laws which needed to be addressed. We modernized the doctors, the Fiji Medical Practitioner Act, the Medical Act. We brought in new acts to encompass things like HIV, and even the Ambulance Act was a new act. So that Mortuaries Act. So what happens is there were strict guidelines and policy decisions which we need to address as leaders, so that the programs which develop from the strategies are then put into motion to effect the health of a common man on the ground.
Okay, wow. Now, when you became the Minister for Health, you said, and I quote, the White Paper document on proposed Fijian health 2015 to 2030 outlines all those reform measures undertaken in the last 6 years and the need for oversight. This document provided alignment footprints to the Global Post Development Agenda 2015 to 2030 based on the continuing strategic governance, leadership in health, using evidence based approaches to decision making, planning, policy formulation for best outcomes for all Fijians. End of quote. On paper, the white paper document looked good. It certainly sounded good. Dr. Sharma, tell me, whatever happened to the white paper document? Did it ever see the light of day?
It's probably getting dust in some bureaucratic office. If you look at it, we had the Millennium Development Goals from 2000 to 2014 and 15. It was superseded by the Sustainable Development Agenda 2015 to 2030. And within that context, you have universal health coverage. And universal health coverage aims to reduce inequities in health. Inequities as it relates to gender, race, where you stay, all the social determinants which affect poor health care. So what we really needed to do was to bring all those angles together and be able to provide a strategic direction to government and to the bureaucracy, so that what would happen is there would be meaningful gains towards the health of people. And unfortunately, I don't think that has progressed after I left.
Wow. Now, at the time that you became Minister for Health, and during your maiden speech in Parliament, you said, and I quote, unfortunately, clinical service delivery is adversely affected by politics in the civil service. People detest change and raise barriers, stall progress, and effect reversals despite nod of approval at face value. When root cause analyzed, patient complaints originate from poor communication of service processes, lack of vision, planning, and poor execution of policy by the executive arms in governance. End of quote. Now, it just seems that nothing has changed at all. These are still patients' complaints, lack of effective communication, lack of vision, etc. Pray do tell me, what was the root cause analysis?
Now, root cause analysis is like, just in layman's term, if you have some weeds in your garden, if you just trim the weeds or the leaves and you let it be, the roots will then carry on and new leaves will sprout. So what happens is root cause analysis. We go for the roots. We got to root a problem out to get rid of the weed. So as a consequence, what we're trying to do in healthcare is akin to what is happening in the advanced aviation industry, the building industry, where they go in and they identify what the problem is before they can able that which will enable them to be able to take effective measures so that things don't become recurrent and problematic. All you need is sort of commitment and a refocusing and thinking outside the box and moving ahead and getting things done. But unfortunately, because of poor executive oversight, poor leadership, and with the bureaucracy, what happens is people do not want to change, or they, if they wish to change, they take their sweet time, and
So I
nothing
guess
inspires.
I'm not trying to put words in your mouth, but I guess the root problems still exist today. That is
Yes,
why the
yes,
health service system in Fiji is absolutely chaotic, for want of a better word.
yes, I agree.
Okay. Dr. Sharma, you also spoke of the micro picture of health. What did this encompass, and what was the micro picture of health then when you became the minister?
Well, if you look at the micro picture, micro meaning is at the bottom end. The people who are living in poverty or close to poverty had a simple wish. They wanted some security around where they stay. They wanted at least some water and electricity in their homes. They needed a little bit of graveling on their roads so that children didn't end up with mud, all over their legs before they went to school. And they did say, "Doctor, please uh, make sure that there's some Panadols in your health center so that we can, if we have a bad headache and we are stressed, we can go and seek those items." So those were the requirements of the people. And unfortunately, the requirements have still not been met. And if you look at what happened in 2014 and 2018, we seeing the same recurrent problem, and it's getting more intense because people are still living in a greater amount of poverty, and they haven't been able to talk anything beyond that. Nobody's talking about strategy. Nobody's talking about policy. We all stuck in that sort of gutter where we worried about security of our where we stay, food security. We're talking about our roads being bad and the water being intermittent and the electricity being so expensive. So we haven't shifted one bit in the last 10 years.
And why do you think that is?
Well, your guess is as good as mine. We all know, and I'm quite sure the listeners, have their opinion too.
All right. Well, you called for the executive arm of the government to address the triple burden of disease nationally, that of communicable, non communicable, and re emergent diseases. What has the progress been on this front?
Well, there's been very little progress in this area, especially in the last 2 years, because our focus has been on basically containment and then keeping an eye on the COVID. So the rest of the programs have completely been shelved, and we're seeing a huge amount of communicable diseases recurrently being present with the seasonal variations, leptospirosis, dengue, and typhoid repeatedly for surfacing their ugly heads. And communicable diseases is really, sort of gone beyond control with all of over 80% of deaths prematurely now taking place with NCDs, and sort of all the other things like mental health, cancer is really major problems. But we have not been able to address that. Major studies on dental assessment, which are done 10 yearly, haven't been undertaken. An environmental profiling of water sanitation and overlapping it with these communicable diseases has miserably failed, and we aren't in a position to make any decisions. So, we really gone backwards by several decades.
Amazing. Now, would you have any data in terms of the triple burden diseases? I mean, I'm not after graphs and all of those things, but any available figures on hand?
Well, as I said, NCD, premature deaths, now is accounting for 83% of deaths in Fiji. So that the highest contributor is heart disease. Then you have other diseases like diabetes, which is rampant. And, God forbid, what will happen is we aren't keeping a close watch on mental health diseases, anxiety, depression, the amount of suicide is up on the high, getting increasingly common and very worrisome too for the health profession.
Yes, well, mental health issues are very, very important. And I believe I read somewhere that in Fiji currently, men supersede women in terms of suicide rates. Would I be correct? Have I read that correctly?
You are probably right. Yes, if you look at the statistics which are coming out from the police, despite the ban on paraquat and other herbicidal items, there are other items are now available where people are using. And then the previously women used to commit suicide a lot more than men. But the preliminary data for the last first 6 months of 2021 shows a higher completion rate of suicide by hanging in men, and that's
Now,
very stressful to
indeed,
all
it
of us.
would be too. And would the suicide also be part and parcel of what is happening in today's society in terms of societal needs, in terms of perhaps the pandemic, in terms of unemployment, in terms of the high cost of living? Would I be correct in assuming that?
You are totally correct, Sashi. There's no two ways about it. All that is compounding. If you look at suicide, there's multifactorial reasons why, all this compounds on the human, brain, and sometimes it might be a totally unrelated trigger which, shifts them into seeking to terminate their lives.
Yes, I've also come across, and this forms a sad part of today's society that we live in. Um, any man, let's take a man, loses his job, goes home at in the evenings, pretends he has a job in terms of his wife and children, leaves home in the morning hoping to find a job, and then eventually the truth comes out, and reasons for being embarrassed, reasons for not being the family provider, reasons for not being an adequate husband and a father. These are all stresses that leads to possible suicide outcomes. Don't you think so, Doctor?
Yes, Sashi, that's quite true. Even for that matter, on the other hand, not many men will internalize their fears and concerns. Some of them externalize it, so you get domestic violence on the increase, sexual violence on the increase. So it's all part and parcel of a complex human problem at present.
Now, you also said that special needs diseases, you mentioned mental health care, cancer, and diabetes cannot be treated as business as usual, and that it needed alignments. What did you mean by that?
Well, you see, if the amount of cancer, we take the example of cancer first. You got cancer, we have the two arms of cancer treatment, surgery and chemo, available generally. And on the other hand, we have no leg to stand on as far as radiotherapy goes. So that's a missing link which really needed to be addressed and brought forward. If you look at mental health, there's a great stigma around St. Giles Hospital, and really we need to be able to refocus training research in that area. There must be greater awareness of these issues in our country, and sort of diabetes is having a raging havoc in our people. People are dying of heart disease as a result, kidney failure, sort of needing dialysis, and we had the infrastructure set to be able to do kidney transplant, but the kidney transplant law is still sitting in the Solicitor General's office for the last 10 years. And so these are things which have impeded the growth and development of clinical services.
Now, when you became the Minister for Health, you spoke of universal health coverage and said that this needed the greatest injection of innovation in Fiji. Was this ever achieved, Dr. Sharma?
Universal health coverage is a concept we are talking about when we talk about the Sustainable Development Agenda 2015 to 2030. What it does, the aim of universal health coverage is to reduce inequities in health care and healthcare delivery. So, those who can afford it usually will be able to seek treatment locally and abroad. For those who don't, they basically go to the health center and they die as a complication of that. So these inequities must be adjusted in such a way that there's some health insurance coming, a national health insurance or social insurance need to be put in place, and the private sector and the private sector need to be integrated in some sort of partnership. And some work has been recently done with the COVID period last year, that it needs to be extended so that the private and public sector work in tandem. So what happens is at the end of the day, everybody gets better care. So those inequities are removed, whether you are urban dweller or whether you're living in the rural or peri-urban area or you're living in the maritime area. Because there's been a massive movement of people. People have moved out of Lau Islands, the Lau group of islands. People have moved out of Maduata because of various reasons. For education in Lau, they've moved children to Suva and the parents have moved in. So you're left with the grandfathers and grandmothers on the island. Maduata had land issues, so the Indo-Fijian population has moved to Nasino. And as a result, there's inequities of distribution in the supply chain of medicine, and the health system has not taken credence to this and readjusted the supply demand issues. And as a result, it worsens the supply chain of medication and things.
Now, these questions that I have asked you all tends to suggest that you had great plans for healthcare in Fiji. Now, how many of these plans have in fact been achieved, and what do you think you could have achieved had you remained as the Minister for Health?
Well, I think sort of preliminary work was done in a lot of these areas. We established good things in the ministry. We established a policy planning, budget analysis, national accounts committee, or a group of young people who were working vigorously to update our policies, our strategies, how to address the programs. So those things did take off, but unfortunately, when I left, sort of they dismantled some of these units, and so we got rid of policy development. We were the first Pacific Island country to have a policy development unit, and now we're back to square one. So really, we need to be able to address this to take our healthcare delivery to get it back to at least some semblance of some degree of normality, and then push it forward. Because we are the second largest island group in the Pacific after Papua New Guinea.
Let me just say investment in health and education is the need of the hour. The nation's future and well being depends on this. And I guess the sooner this is realized in Fiji, the better it will be for one and all. You are watching Sashi Singh's Talking Point, the Thinking People's program. We ask the questions that Fijians want answers to, Fijians deserve to know. Our chief guest this afternoon is Dr. Neil Sharma, medical practitioner and former Minister for Health in the Fiji First Government. Please share the link on your own timeline if you can, so that you could include your family and friends in this broadcast. And a full recording of this program can also be viewed later on Facebook and YouTube as well. And if you go to YouTube, please subscribe to the page so you get all future posts as well. And with regards to comments regarding the health services in Fiji, Doctor, have a drink. I'll just read out a couple of comments. Um, Vinod Chandra has written, there is absolutely no duty of care. Patients and visitors are often spoken with rudeness. Those who don't speak up just have to face the brunt of it. Very, very saddening indeed. Keep those comments coming, and I will try to share some of those comments. Um, there's another comment here from Dilip Kumar. Says, I have unfortunately recently have made few visits to the CWM hospital, E&A, and I found the doctors and nurses providing excellent service. The enthusiasm is bogged down by little or no appreciation of their efforts and lack of good working atmosphere. Well, I guess we're not in any way trying to condemn the hardworking personnel in the Fiji Health Services. I must say, I have known of doctors and nurses, and I hope you can comment on this, Dr. Sharma, that some of these personnel have gone over and beyond the call of duty to work so hard.
Yes, Sashi, this is very, very true. I think those people who are working currently and have worked in the past have gone beyond their duty of care. In fact, personal, sacrifice, the number of hours they work. If you look at the junior doctors, they could be working 36 hours on a stretch, and it takes a lot of effort to one become a doctor, two then to work those long hours, and previously they were very underpaid. So reasonably they're catered for at present, but they need a clear pathway to go up there in their professional career, and that is somewhat missing now. I mean, everybody should be offered a place in a postgraduate training program, and that should be subsidized by state to a certain extent, so that we're not pushing these young people out of the seminar. There's something called a push factor, and there's a pull factor. People turn around and say, "Oh, the doctor, migrated to Australia, to New Zealand." Now, nobody wants to migrate. Everybody would like to serve their own community, stay at home, and feel comfortable. So, but if we're the hierarchy, the people up at the top don't support them, eventually frustration does set in with the long hours of work. And that has been academically studied in Fiji. Likewise with the nurses. There's exodus of nurses now, and technologists and scientists, because
We'll,
basically they're overworked.
we'll come to the issue of nurses in a moment, Dr. Sharma. Now, I've termed this next segment, I've termed it the inner sanctum, and I'll tell you why. Let me now take you back to your days in the Fiji First Government, and I see you smiling there. I think you know where I'm going to go with this. Now, you were in the inner sanctum of the Fiji First Party. How would you describe the workings of the Fiji First Party?
Um, Sashi,
Yes.
put it this way, uh, if there was an inner sanctum, I wasn't part of it. Right? And the perception of the public is very, very true that, sort of the government works according to the whims of the seniors in it. And the rest of them are just, sort of players doing their little bit in whatever way they could. So really, there's no inner sanctum. as
Well,
such.
you were a minister. You were the minister for health. One would perceive that as the minister for health, you would be in that inner caucus, in that inner sanctum, as I say. Were you not?
No, no.
Wow.
I mean, there were occasions where we socialized. People would say, "Hey, Doc, you'd be sitting down and having a grog with the PM, or having a whiskey with the other in the others in the system." But that was not the case. We were all whisked in by bodyguards, and we'd stand around in a suit and a boot, and with a glass of wine in our hands, and we'd have a drink or two, and then it was time to move on. So it was very formal, very militaristic, and there was very little discussion as such. We only met in the cabinet, and it was usually a formal endorsement, one way or the other, a few announcements, and then we moved on. So really, if there's no inner sanctum, I'm sorry, but that's the facts.
All right, I'm going to come to the workings of the cabinet shortly. Now, many believe that the Fiji First Party, that it's a one-man show and rubber stamped by the other. Do you have any comments on that? What do you say?
I think your perception or the perception of the public is probably true.
That's all you're saying?
Yes.
Okay, now, why is it that many people are of the belief that many of the political representatives of the Fiji First Party are only a support act or mere puppets while Parliament is in session and hardly make a noise when Parliament is not in session? I'm talking about the other members of Parliament on the government side. Would you like to comment on that? And, are people's perception correct?
I think the people's perception is true. A lot of our ministers, even now, are fearful of making open-ended statements to the public. They would prefer to read from prepared statements or speeches, and those speeches are by the government's communications unit in Gogis.
So you said there's a fear. Fear of what? Fear of who?
Of being reprimanded for sharing your personal views or your ministerial views. They are all held on a tight leash, I should say.
Wow, it's amazing that a minister holding the portfolio of a minister still needs to be reined in by a leash. Oh Lord, it's dog eat dog world out there. Now let me let me ask you this: when the government comes up with a policy, does it go through the cabinet? Is the policy deliberated upon? Is the policy debated in cabinet before a decision is made? Or is it just yes, sir, no, sir, three bags full, sir? What is it?
When a policy is made, usually the ministry, relevant ministry, makes a submission, and that submission then goes and is vetted by the Solicitor General's office and endorsed by the Attorney General, and then it is presented to Cabinet for presentation by the Minister, and there may be some minimal discussion there, and thereafter it is endorsed. So it goes up the channel, it goes through a process, and at the end of the day, generally speaking, there's very little discussion.
Now, Dr. Sharma, I'm going to ask you another question, and I hope you're comfortable with this. It has been seen on several occasions that the Attorney General of Fiji comes out to announce a government policy, respond to alternative proposals by the opposition on matters that fall under the portfolio of another minister. Why does this happen? Why is this role taken off the relevant minister? Why can't the relevant minister actually front up and announce the government policy?
It is confusing. It is sort of mind-boggling, and I think in the Westminster type of liberal democracy, it would be quite reasonable. It would be the normal process that the minister would present his paper, and it would be discussed in Parliament. Unfortunately, that's not happening in Fiji, and I have no idea of why it's happening, but that is actually happening, and it's unfortunate.
All right, I respect your views. Now, you were part of the, as I say, and I'll maintain that, the inner sanctum of the Fiji First Party. Now, is the Fiji First Party controlled internally by just one person?
Um, I think your assessment is probably true because the party caucus never met in the full, time I was there, and the decision was made by government. So really, I think the party is subservient to the government, or there's confusing roles. I mean, if you have a party and then it forms the government, there should be some communication links, linkages between the party and the government. But it's all meshed up into one, and the players are probably the same figures.
Well, it seems that the major decisions are made by one person, endorsed by the party, and presented by the one person, one party. Let me say at this juncture, and our viewers who are watching, if you're probably wondering, in the interest of transparency, whether or not Sashi Singh's talking point has invited the government side to come on the program, let me say categorically that my invitation to the Attorney General's office still stands. Recently, I've written to the Minister of Health's office. I've also sent correspondence to the Permanent Secretary of Health inviting him on the program. And so far, I've only had the courtesy of a one line reply from the Permanent Secretary of Health's office to say that my email has been received and it will be responded upon shortly. Nothing from the AG's office, nothing from the Minister of Health's office. So my invitation stands. We're deciding to address critical issues in terms of the Fiji First government. And as I say, come on the program, share your thoughts. I will give you the honor of presenting your side of the story, and you should be prepared to face questions from me, questions that needs to be answered. So, if any one representative of the Fiji First Party is game, please contact me at sashisingh at bigpond.com. You have my address, you have my phone number. It's easy. Contact me. Let's rock and roll, and let's call it a show. Now, let's move to the subject of resignation. Dr. Sharma, you joined the Fiji First government in 2009. In your maiden speech in Parliament, you said, and I quote, and I find this somewhat prophetic, I do not know whether I will be in this place short or long term. That is for others to decide. But what I do know is that I have no intention of being here for the sake of being here. What did you mean by those words?
Okay, Sashi, just a clarification. I joined the interim government in 2009, and when the party was formed in the for the just before the 2014 election, sort of I became a member of Fiji First then, and my membership really lasted 9 months, 8 9 months, and I resigned. When I resigned from Fiji First,
No,
automatically I
no, hold on. I'll interrupt you.
uh,
We're going to dissect your resignation in a
fine.
moment,
Okay,
but I want to stick to this in your maiden speech. So you've
mm,
made it into Parliament. You
right.
said, I stand corrected, yes, in terms of the government, but once you entered government, in your maiden speech, you said, I do not know whether I'll be in this place short or long term. That is for others to decide. But I do know, but what I do know is that I have no intention of being here for the sake of being here. My question is, Dr. Sharma, what did you mean by these words?
Well, basically, I went in there. I went into government to serve the people. I have always been a scholarship student all my life. I owe it to the people of Fiji, to the people of India, to the people of New Zealand for my education. I did not go to Parliament or to Fiji First to make money, to make a status symbol or anything else. I went there for the benefit of my people. And I think I know sort of I wasn't too sure what was going to happen after the 2014 elections. Basically, I was given my portfolio at that point, despite the reassurance from the Prime Minister about a week earlier, and I wasn't even given the courtesy of being told that no, you need to step down. We need to train somebody, and you can oversee them. But that is part of what happens with the Fiji First. Nobody is in the area of expertise. So we have economists, we have lawyers, we have other people, but they're all working in different areas, and as a consequence, I don't think we're getting the best out of it. So when I was not given my position, or I was not even notified, and I said to myself, what am I doing here? And
Hmm.
I'm no longer I'm going to be a rubber stamp to anybody.
Okay. Now, you suddenly resigned on the 10th of April 2015. Why did you resign from the cabinet and the FFP?
Well, the first several months while I was there, we were just rubber stamps. We were told to vote this way, yes or no, never to vote on our opposition vote. And in the interim, there was a foreign affairs position available as high commissioners to New Zealand, Australia, China, and Brussels. And I took the liberty of meeting the Prime Minister a couple of days before, and I explained to him that I was sitting on the back bench. I wasn't using my brain in any way. I was just sitting there and rubber stamping things. And it was, maybe I could serve him better by being a high commissioner somewhere. And following the interviews, I was shortlisted. I was the top candidate for one position. And as a result, I was not given that position. And I asked myself, what am I doing here? I'm just sitting around and just ticking yes, no, and sort of speaking up without reason, without intellect. And I decided that when a vote by the opposition came on a bipartisan committee to be formed to look at health, the supply chain of medicine and consumables by the Ministry of Health. And it did make sense because I had resolved that problem. The
Hmm.
documents are with the permanent secretary of health, the former permanent secretary of health, and with the pharmaceutical services. How to go about not having such huge shortages. That problem would have been minimized if they had followed the master plan which we had given. But when the change came, when the leadership changed, everything stalled and no directives were then forwarded. And as a result, we are back to square one and even in a worse position now. So this is the reason I voted on an opposition vote. And when I did, I was reprimanded. Basically, initially, Tikondondua, who was the leader of the house, asked me, and I
Hang
said
on,
it was
Dr. Sharma, hold on, if I may. I'm
yeah,
going to come to that part shortly because I want to address that separately.
okay.
Now, you just mentioned that you voted with the opposition. You have your democratic right to exercise your conscience vote. Now, this may or may not have been allowed by the Fiji First Party. My question is, in all your time in Parliament or with the Fiji First Party, had there ever been voting on a conscience vote basis?
No, it's
Okay.
a block voting.
All right. So it's all for all, none for none sort of thing.
Yes,
Now, you mentioned that there was a motion on which you crossed the floor. Um, could I just ask you once again, what was that particular motion? You mentioned, I think, that the motion was to have a committee look at controlling, was it NCD?
there was a request from the opposition to establish a bipartisan committee to review the supply chain of pharmaceuticals and consumables to the Ministry of Health to improve or reduce the shortages and outages of medicine and consumables,
All right.
and basically it deals with NCD. Yes,
So you voted with the opposition, and that got people's noses out of joint. At the time of your resignation, though, you said you resigned for personal reasons. It was reported at that time that that one man, the AG, the person holding so many different portfolios, the Fiji First Party General Secretary and registered officer, that he gave you the ultimatum to resign or to be sacked. Firstly, is this true?
yes.
So you got an ultimatum: resign or
Resign, resign or be pushed out.
okay. Now, why would he have given you this ultimatum?
Yes, I guess I was an example because I was the first belligerent child of the party.
So you think you were being made an example of, so others within the party would not ever cross the floor.
Yeah, agree.
All right, excuse me. Now, I need to ask you this. Were there ever any allegations leveled at you from within the Fiji First Party? Were there any rumblings within the inner sanctum about you perhaps not doing an effective enough job, for instance, or any allegations of impropriety against you in the past, or any irregularities in your actions as minister? Did any of these things ever come up?
Well, there's nothing objective. There's nothing objective. I think I was working within that constraints of time, constraints of finances, and I think there's nothing which has surfaced then or up till now. Because if there was, I'm quite sure there'd be sort of legal ramifications of that. Of course, when a minister or former minister resigns, there'll be some rumors here and there. They'll try and say that maybe he was playing up with something and we're going to investigate this and that. But nothing's ever come out of it because we tried to sort out the procurement system of medicine, equipment, technology to the Fiji government in the Ministry of Health, and we optimized that. So we got hold of some people who were making money out of this. And this is a group which went and possibly said that maybe there's a change that I might benefit from this, but never. I was a person who working with my team. We looked at optimizing our equipment and technology. It was during that same period that Fiji received 3 new CT machines, 1 MRI machine. We received X-ray machines, a new set of equipment for the labs all throughout Fiji. So really, that was a milestone step forward. And of course, to some extent, some of the equipment is still working. Some of it has not been serviced. Post-warranty, service agreements have never been uh, fully utilized, and as a
Okay.
result, things have gone wrong.
I'm going to come to equipment and machines, etc., in a moment. Now, still on the topic of your being pushed out of government, the then leader of government business in Parliament and the Minister for Infrastructure, Honourable Pio Tikunduandua, intervened and sought the Prime Minister's reprieve when your crossing the floor became an issue. Now, it has been stated in this SSTP program by the Honourable Pio Tikunduandua that he approached the Prime Minister and asked the Prime Minister to reprieve you, to give you, a pardon, and that the Prime Minister had agreed. However, the Prime Minister changed his mind when allegedly persuaded by the party secretary to either sack you or to get you to resign. Now, you've just confirmed that you were told resign or get sacked. So this is true, isn't it? What Pio has said,
Totally true.
totally true. Now, Pio Tikunduandua raised that with the Prime Minister. When the Prime Minister changed his mind and you were pushed out of Parliament, Pio Tikunduandua later resigned over the issue. Do you have any comments in Pio's actions What did you think of his actions in resigning?
I think he is a very honorable man. He's a thinking man, and he stood up and understood the position I was in, and he negotiated and discussed it with the PM. But then he was told that his opinion did not matter subsequently.
Okay, now, in a situation such that you found yourself in, do other cabinet ministers or do other members of the government side, do they have a say or a vote when it comes to a dismissal of a member? Or is it the decision of just one person when it comes to getting rid of a person like you? What's your
Sashi,
opinion?
Sashi, you said the mouthful.
Okay, all right. I think you've already answered that. Well, you were part of the inner sanctum when you were Minister for Health. Now, there is a perception that the Prime Minister is completely disengaged from the governance issues in Fiji, and that in fact the Attorney General is the master and commander of the whole shebang. What can you say about that perception?
I think your perception is not off the mark. Public's perception is not off the mark. We have a very autocratic type of governance in Fiji at this point in time.
Okay. Dr. Sharma, do you have any regrets about having to resign from the portfolio from government?
Yes and no.
What's yes?
Yes,
What's the yes part?
yes. Part is that there's so many unfinished businesses in
Hmm.
the healthcare delivery system. There's infrastructure, there's policy, there's manpower needs which need to be addressed. So I feel sorry for the team which we've left behind, and they are, sort of taking a huge load. And somewhere along the line, if we're not careful, they will buck up.
You
Uh,
said yes and no. So what's the
yes,
no part?
and no, I'm happy that I did because I couldn't see myself sitting there for another 3.5 years and facing such opposition or such sort of incarceration and not being able to use my intellect to influence things, to discuss and dialogue with people. What would happen? And I've never been a yes man to anybody. I've always expressed an opinion, and I appreciate everybody's opinion. So what happens is there must be a fair give and take in such situations. So I'm happy that I moved out at that stage. But then life has its own things for you in play. Personally, I've had gone through some very emotional traumas in the last 4 or 5 years, and that's another story for some other time.
So you are trying to say that this whole saga, it sort of had a personal toll on you, I guess.
Yes,
Did this have a personal toll on you, Dr. Sharma?
yes, it did.
Would you
Yes.
like to share anything with us?
Well, I lost my wife.
Wow.
She was un, un she was sick. She
Right.
became, and I had to rush her to India for major surgery. I went back. Her recovery was slow, and depression set in. We were raking the bottom of our finances. Practice wasn't running at all for good 6 8 months, and she slid into severe depression and took her own life. So it destroyed my family life.
Wow, I'm
And,
so sorry
and,
to hear that.
and additionally, my children were affected in various ways. They were,
Wow.
roadblocks, but, God is great. They've all bounced back and on their feet and reasonably comfortable in their life, stable. So that always gives you hope that when you're in the pits, you will not remain in the pit, but someday you will come out. Someday, to the others, when you're on a mountaintop, don't remain there. You will fall into another pit. So the cycle of life continues, and I'm happy that I moved out.
Dr. Sharma, you have our deepest condolences. as there are times that the public do not get to realize the personal sacrifices and toll that takes place in the name of community service. And to you and your children, our deepest condolences. Now, one thing that you said is just gnawing at me, and that is a person of your intellectual ability, an academic, you're sitting in cabinet, ready to, share, brainstorm, to interact, and you're supposed to sit there and just yes sir, no sir. That would be, bereft of ideas. It would sort of leave you academically unchallenged. How would that make you feel?
Oh, that was an awful 5 months. Awful 5 months as a member of parliament. Uh, because I had the experience of having been in the previous interim cabinet for 6 years, and so there was fair exchange. But after the 2014 elections, things changed dramatically. It became very authoritarian, and as a result, I think all those thinking members in parliament, I don't know what they're doing. They're probably waiting for their pension to arrive or become eligible for pension before they, split ranks.
You are watching Sashi Singh's Talking Point, and our chief guest is Dr. Neil Sharma, a medical practitioner and former Minister for Health in the Fiji First Government. Doctor, have a drink if you'd like to. Um, so, folks, if you can share this page, you'd be able to do us a great favor by letting people listen to Dr. Sharma's interview. And if you have thoughts about your time or the health services in Fiji, you could share that. I know there is a veil of fear that permeates in the Fiji culture where people are afraid to put their thoughts even on Facebook, and I respect that. But I've had a friend who's recently, in fact, he just flew in from Fiji on Friday. He went to see his very sick mum, spent 10 days there, spending most of the nights in Suva CWM hospital. And he has told me that the situation in the hospital is absolutely atrocious, very, very nasty things. And, I'm just waiting for other people to back that up. However, let's move to some health projects in the pipeline. Dr. Sharma, when you resigned, what plans were in place for the health sector? As you said, you had unfinished business. How were you going to improve the health sector for the people of Fiji?
We had major infrastructure and human resource development taking place in the area of mental health.
Hmm.
For taking mental health first, we had plans to establish a new hospital, a new institute of research and clinical services out of the St. Giles premises, which is very stigmatized now. And that was one. We decentralized the care of into the central three divisional hospitals, and we were going to take it down right down to the subdivisional level, so that doctors were trained. Additional training had been provided for doctors, and that has stopped, unfortunately. It was all scholarship through WHO towards a postgraduate diploma in mental health, and we had planned a master's in psychiatry to follow. All that has been totally blocked, and it hasn't taken place. So we're really in for difficult times if you're developing and needing any aspect of healthcare, such as anxiety, depression, which most GPs can handle, but sometimes you need specialist psychiatrists and counselors and aspects of developing alternate skills for individuals. So that's because St. Giles not only keeps long-term patients, they have sort of patients who have committed crime, homicide patients, right next door to them. So what happens is that needs to be addressed, that needs to be separated, and St. Giles Hospital needs to be more like a halfway home. So that was one. It was something which was dear to my heart because, as I said to you, I went in looking for aspects of healthcare in mental to provide better mental health services to our people. So that was a famous work in progress, which has completely stalled. Then we had the case of developing a cancer hospital, a cancer facility with radiotherapy. Much work had been done into this. We had worked in with WHO, with the Korean Cancer Society, Cancer Unit. We had to talk to the Tata Institute of Atomic Sciences for training of our people. And we had endorsement from the International Atomic Energy Agency, who were going to fund this hospital. And it was going to be a turnkey operation. After I left, the permanent secretary at that time did not write a cabinet paper seeking cabinet's full endorsement. And if that paper was there on 21st of January 2020, we would have received a brand new cancer therapy unit in Fiji, which have served not only Fiji, but the region. Places like Kiribati, Tuvalu, Solomons, where patients have to travel to India at great cost and great time, and with great cultural differences, they would have been much more adequately treated in our islands, and at the same time, our patients would have benefit. Now we are down to begging and borrowing money, and by the time the patients are ready to go, some of them have worsened, and basically it's just a death certificate which is given to them, because there's minimal palliative care available in Fiji too. So that is one of my biggest concerns. The other things were development of CWM's maternity unit, which hasn't taken place. It's completely stalled because of no money. Likewise, Nasori Hospital, which is on the river bank. So really, we need to move our hospitals to higher ground for long-term and safety of our patients in natural disasters and floods. And of course, Bar Hospital is still not operational, despite our initial move to get it off the ground, develop it, and so it looks like there's going to be massive cash injections into it before even its IT starts.
Thank you. I was going to stop you there because Bar Hospital, Lotoka Hospital, I need to address that separately. But what you've just said, and correct me if I've not heard you properly, I am absolutely dumbfounded, astonished um, that you mentioned the cancer hospital, the cancer center that was supposed to be set up, that a, a permanent secretary did not present a paper to cabinet, and that's one of the reasons why we don't have a state of the art cancer center in Fiji. Did I hear you correctly?
Exactly, you did.
Oh,
Everything
Lord.
was done. The funding and everything was done. The preliminaries, planning was done. All we needed was an endorsement of government. In International Agency for Atomic Energy would have moved in, built the hospital. We would have trained our personnel in Korea and in India, and we were ready to roll. We can rock and roll it there.
All right. Well, which government are you talking about and which year?
This is the way this is talking about the current government. This did not take place in 2015. All the preliminary work was done between 2012 to 2014. And all it needed was a cabinet paper which said that they need a whole of government endorsement.
Do
And
you
because
know
the
what
paper was, all that funding has gone elsewhere, probably gone to Africa or some other Asian country.
Do you know what happened to that permanent secretary?
Mhm. She's
Okay.
around.
All right. When you were the Minister for Health, what sort of budget did you have?
About 214 million.
240.
Okay. I mean,
Dr. Sharma,
we can't look at exact numbers. What you need to look at is some comparative data. Well, health to GDP, health to total budget. Now, what happens is if you look at health to total government budget, is 9%. WHO regional values, mean values are about 14%. So we under by 5%. Government to GDP is 2.8%. That should be at least 5%. So you may ask me obviously that why didn't you gun for more money? We were limited initially in 2009 when I came in. The government gave me the health the priority. But what happens if there were other areas the money was needed to be shifted to? And I had to work on efficientizing the system. And sure enough, by efficiency, we did not ask for one extra cent. We were then on a positive roll to develop all these things. We were purchasing equipment, we were developing public health and private health care. And obviously, in that 4-year period, we would have gone up. We'd ask for more once we had consolidated our position. Currently, I think it's about 400 million.
Yes, it's
sort of
just
doubled.
yes.
But
The
the
budget
ratio,
budget.
the
You are right.
ratios
The
have
budget
gone down.
estimates. Yeah, you
The
are right. The
ratios have
budget
gone down.
estimates. Yes, the budget
Sorry.
estimates for 2020, 2021 has it at around $400 million. Now, let us look at the health services today. Pray to tell me, why is the state of the hospitals in Fiji so bad? As I said a little while ago, my good friend came back on Friday. His one word description was atrocious. Why? Why is the state of hospitals so bad? Any thoughts on that, Dr. Sharma?
That is a bureaucratic issue.
Mhm.
Bureaucratic meaning not in a bad way. It means that the permanent secretary and all his underlings, the directors, the medical superintendents, the divisional, subdivisional medical officers, the nurses, the matrons, somebody is not doing the job. If the toilets are dirty, if the cleaner isn't cleaning the toilet, then who is responsible for supervising the cleaner? I mean, why is the matron of the hospital, why is the doctor in the hospital not doing a round around this facility? Why is the gardens not well kept? Why can't we use the correctional service to clean the compounds? Why can't we get the cleaners to work properly? Why can't we provide them with cleaning detergents? So that is an oversight by the immediate bosses. I mean, if they're sitting in their offices and they say they're inundated with work, I mean, as a minister, if I can walk around every facility, and I used to walk into the toilet when I visited an institution, and then I'd haul up the doctor or the sister or the cleaner and ask them, what is your problem? Why is this patient not spring clean?
Well, let me say this. If you or I, if we were the CEO or the general manager of a company, and if our company was to slide into such abysmal performance, or as people describe, an atrocious state of affairs, you or I will be taken to task as the CEO or general manager. So, who is the blame to be apportioned to? Who should accept the blame? And where should the buck stop? Because in that example that I've just given you, you or I would have to resign.
It depends on where it goes up to the authority level. If we're talking of healthcare, then the permanent secretary of health and the ministers are responsible, because the minister must have executive oversight. If the minister is leaving it all to his permanent secretary and to the directors, and they aren't doing their job, then he is the person who's sitting there. And, but on the other hand, if you look at it from a government point of view, you take it up further.
Well, I tell you, if we followed the Westminster system and all these atrocious standards were in place, and I guess accountability was non existent, somebody would have to fall on their sword, and a number of resignations would have to be tendered in because the public would demand for it. Now, that's my opinion. Now, Dr. Sharma, why do we hear that there is such a shortage of medications and essential items in hospitals or health centers in Fiji?
This has always been a chronic problem because what happens is the supply demand has not been evaluated fully. And as I said, alluded to previously, that was something which we had undertaken and it was ready to be done. So simply, in Fiji, there's in-country movement of people, and we've talked about people moving out of Madwata and from the Lao group. So there's a decreased number of items required in that area if you carry out a real-time survey, and then you could shift those supplies to where they've moved. So that isn't taking place because our supplies are not being ordered on time, and we're using archaic colonial system of applying. Then our supplies don't come on time, and the people in those areas tend to sort of hoard supplies, and obviously the populations increase. So we need real time figures from the bottom, and at the same time we need to be able to say, what are the new things coming onto the market, where has the price changed, so that expertise is not being used appropriately. And when it is not used appropriately, then there's wastage of things, and then there's a need to be able to transfer things between hospitals and facilities and divisions. And if you can do that, your supply chain problems will be resolved. Of course, it's been worsened with the COVID, because the suppliers have closed down, supply chain is not working properly. So those things add more problems now. But then these are problems which can be addressed.
Now, retired professor of surgery, Dr. Eddie McCaig, a while ago highlighted that 60% of what is on the essential drug list was not available in Fiji. He said this in 2020. He also said that 80% of our diabetics were poorly controlled because of the unavailability of drugs, laboratory testing, and other reasons. First, do you agree? And secondly, has the situation improved?
No, I guess I totally agree, and I think it's worsened. It's worsened because what happened is, sort of people just work day to day, and they do not think about the future within the ministry. And I think it's time people thought about this within the ministry and get your supply chain sorted out, your demands put in place. But I don't know, there's something called the law of the mediocres. You have
Mhm.
the intelligent people who leave. Then the mediocre gets promoted and goes up the line. And when they keep going up the line, younger people who come in, they may be brilliant people, but they get sort of plowed down, or sort of their ideas aren't taken on board because you have a mediocre boss. So it keeps going, and the mediocre in the end survives, but the system fails.
Well, you just said people leave. Why is there such a large number of resignations from the health sector?
Well, what happens is you get tired, you get sort of it takes a toll on you. You burn out, and you're not secure. And it's only human to feel for your children and progeny. And there's maybe a little bit more greener pastures elsewhere, but it's not the greener pastures which takes you there. It's the push factor, as I've said. You get pushed out of your comfort zone. You get pushed out of your home and your environment, and it's quite a daunting experience.
Dr. Sharma, I understand that the retirement age in the public sector in Fiji is 55 years. This means in the health and the education sectors, Fiji tends to lose good, experienced professionals when they hit 55. Now, what impact does this have on the health sector when doctors, including specialists and others, must leave public service when they turn 55? I mean, at that age, are these professionals not at their peak in terms of experience?
Good question, Sashi. In fact, when the laws were applied way back in, I think, 2010, 2011 sometime, somewhere there, a lot of doctors were sent home. But then they realized there was gaps in the service. So most medical practitioners, especially of the specialist cadre, have been taken back on annual contracts. So that's helped some, given some relief. But then what we need is a process of leadership training, professional and vocational training to be put in place so that younger ones are groomed to go up. But then, yes, I totally agree. 55 is a very strange area. And if you look at some countries now, they're going up to 70.
Well, here in Australia, 67 and a half is mooted, and I have a feeling by the time I reach that age, it's going to be 70 years. So, in other words, I'm not meant to retire. So, but look, it's a sad state of affairs where a person who's worked hard, gained qualifications, gained experience, and when it really comes to that icing on the cake period, to provide that expertise and to perhaps train people when they reach that age of 55, they have to pack up and leave. It's a very, very sorry state of affairs. Now, to the
In
best
fact,
of, sorry, go on.
Sashi, when these folk retire, they're on a loose end, and it worsens their hypertension, their diabetes, because they got nothing to do, nothing to look forward to. And unfortunately, the spirit of volunteering has not evolved in Fiji. So it's sad that they have to go home at 55. It's sad that most of them sit around and eventually pass away.
Wow, very sad indeed.
Hmm.
Now, to the best of your knowledge, has there been a problem with the supply of medicine which has led hospitals carrying expired stock, and have patients been given these expired medicine? Would you know about that? Someone's asked me this question.
Okay, thank you. It's a very good question. If you look at WHO standards, and I was quite, interested in this because you have consumables like syringes and needles and swabs, those IV drips, which have an expiry date, and in the developed countries, these get all thrown out. However, they have a life of additional 6 months, so it can be put to use. So these consumables are being used, so that's not a major issue. But so if you look at medication also, a lot of the medication carry an additional life of up to 6 months. So when they say expired today, you can still use it for 6 months if there's a shortage, because it's supply and demand, and how much money you have, and what are your constraints. So I know of situations where things have been used, but this is an area which needs to be worked on. There is a bill or a decree, the pharmaceutical products decree, and this is another area which we really need to follow up because you need to standardize what comes into the country. You can't have products which are not even certified in their own country of origin. Take the example of the Indian pharmacopoeia, not even used in India, and is being flogged off by pharmacy wholesalers out here, and to the detrimental health conditions of our people. So we put that in place, but the work has been tedious and slow, and I don't see anything coming out from this decree or act now.
Now, why is it that people in Fiji complain about the supply chain of medication and consumables? I've been told that medications are not readily available. Some health centers do not have medications full stop. Why does this problem exist? I know you mentioned a little while ago someone's not doing their job, but if this is prevalent across the country, then it is a chaotic problem.
It's just a matter of ensuring that we have the right data and right sizing your supply, getting your supply in increments throughout the year, and ensuring that the endpoint folk are receiving the medication. It's simple as that, but I don't understand if we can't sort this problem out. Problems are meant to be sorted. If you have a problem, there must be a solution, and if you can't find the solution, then whoever's trying to solve the problem doesn't belong to where he should be.
Well, it all just seems that a common sense approach is needed in any facet of life. And it seems that common sense has just gone out of the window in a lot of administrative affairs in Fiji. Now, let me say that Sir Winston Churchill once said, healthy citizens are the greatest assets any country can have. Healthy citizens are the greatest assets any country can have. And it is just heartbreaking to see Fiji's health standards, facilities, and healthcare being left so far behind as if though it belongs to a third world country. That's a very sorry state of affairs. Now, let me take you to this part of my program. Some years ago, two prominent former Fiji doctors, namely Dr. Karam Singh from Sydney and Dr. Michael Sushil Chandra of USA. These two doctors plan to establish a tertiary hospital facility in Fiji. In fact, their project had been mooted over 4 decades to four different prime ministers, two of whom are still alive, and had received the go ahead. And I believe to this effect, land was earmarked in Tavakumbi in Lautoka. However, it has been alleged that when the Fiji First Party came to power, the Aspen Group from Canberra have been outsourced to provide the services. My question, Dr. Sharma, do you know of the mooted tertiary hospital facility by the two former Fiji doctors?
Yes, Sashi, I'm totally aware of them. And, it would be nice to have a tertiary facility which not only serves our people, but it could be a hinge into bringing in regional patients to be treated here, and be able to train our local personnel to become a lot more competent and be able to deliver a better quality of healthcare. So, if you look at the universal health coverage, tertiary care, we've got barely tertiary care in Fiji. It's down to secondary care only. So what we need to do is to integrate these sort of projects and make it happen. In fact, if you look at CWM today, what you need is another 500-bed hospital in Nasino area somewhere, because structurally CWM doesn't have any more parking space, and it's riddled with infrastructural problems. So if the Chinese can build a hospital, a 1,000-bed hospital in 2 weeks, I see no reason why we can't sort of do something about it and build another hospital, move the infrastructure there, and be able to serve our people a lot more effectively. But going back to what you're saying about Vamed and Karam Singh and Michael Sushil Chandra, I take total cognizance of their needs or their desire. These are true professional sons of Fiji who have the heart of bringing
Heart of
in
gold.
heart of gold to bring in these sort of services. But I don't understand where we're heading in this area.
It's a crying shame. Now, is it true that the Aspirin Group were supposed to take over the new Bar Hospital, but that hospital is still unoccupied for the last 3 years?
Yes, that's what we hear.
All right. Now, the Attorney General allegedly is on record as saying in December last year that the new Bar Hospital would be fully operational by the end of January. It's almost 2 months since the projected opening. What do you think is happening? Why the delays?
It's a complex issue. Again, funding would probably be one of the important issues. And, there's been a lot of questions about SPEN being a hospital management company rather than, a supply chain of healthcare professionals. They subcontract work out to others. So really, it's complex, and Bar hospitals, some of its internal facilities have been sitting around for 3 years and non-operational. So all of that is, really needs, several $1 million worth of, fresh injection. So I don't know who's supposed to do that. Whether ESPN will do that, or whether the government of Fiji will provide that, or they will dig into Fiji National Provident Fund for further funding. So it's a complex issue, but I don't see it becoming operational immediately.
Well, you don't see it becoming operational immediately. You may be aware, and I think most of us know, that Aspen had been planning to take over the operations of Lotoka and Bar hospitals, so much so that there was talk that the Lotoka hospital would be providing heart surgeries. How practical would that have been, Dr. Sharma?
What do I say, man? Uh, Letok Hospital's got three operating theaters. One, there was a fire there not too long ago. I don't think the theater is fully operational. It's barely doing emergency surgery, and people talk about the asbestos, sort of ceilings it has and exposure to people's health. And open heart surgery is at the tail end of heart care. If we objectively look at what's happening, you need basic equipment in health centers: a blood pressure machine, a sugar machine, a cholesterol machine. You need your manpower. You need to talk about health screening and lifestyle changes. You got to right size the literacy of our people so that they understand what you're talking about, and that's a conflict at present with what we're saying and what we're doing and what people understand. And that down the line, then you have, if you have a cardiac unit, then you need treadmills. Suva doesn't have a treadmill at this point in time, despite the availability of its cardiac services, which is totally funded by the private sector. The
Wow.
state is not putting in 1 cent into it. So really, the cardiac services need to be improved. Suva and Latoka need to integrate along with Lambasa. And then only you're talking about stenting and pacemaker and all the rest. And then at the end, then you divide up those people who might need surgery and might not. So then you have a efficient private setup at Heart International in Nandi, which is doing thriving business now. And this, I'm told reliably by medical consultants, that there's 1,500 people in the West needing cardiac assessment, angiograms, and possibly cardiac surgery. So that's a huge number, a huge demand, but the infrastructure is not ready.
Wow. Now, it's easy to paint a pie in the sky picture, I guess, because let's face it, for open heart surgery to be feasible, a number of questions needs to be addressed. Who's going to perform the surgery? Where will the specialist heart surgery team come from? Where's the state of the art equipment going to come from? Who's going to fund the project? All these questions, and I guess we don't have answers to any of these. Would I be correct?
If the health administration was working efficiently, we had open heart surgery subcontracted to an Indian hospital group, and it was being undertaken very successfully in Suva and in Lotoka at that point in time. However, when the term came to an end, they were not even given an interim extension whilst new applicants were looked at. They were told to just pack and disappear. And they just did just that. So the whole open heart surgery thing came to a halt. And that
Wow.
is profoundly sad.
Wow. Dr. Sharma, the shortage of drugs issue in Fiji is not new. In 1982, the president of the Fiji Medical Association, Dr. Karam Singh, and at that time, you were the secretary of the Fiji Medical Association. Together, you made representations to the then Ratusir Kamisesemara government to conduct an inquiry on the shortage of drugs. Now, due to the pressure exerted on the government then, an inquiry was conducted under the leadership of Dr. Hemming, and it was found that there was a shortage of drugs by some 50%. I know that in recent times, the National Federation Party have moved two motions calling for an inquiry on the delivery of health services. Motions moved in Parliament, but nothing eventuated out of those motions. As I said, you were part of the government. Why do you think the government cannot see that there is a dire need to establish a commission of inquiry into the health service? Is there something to hide or to be afraid of the finding of such an inquiry?
I think we need to just step back and ask ourselves as to how we're being governed, why people aren't, voicing their opinions, why are they sitting back and, sort of accepting the current situation. I think, this must make people think as to what we are doing, where we should be going, and how we should be projecting ourselves. Because that was the situation in the 80s. It improved marginally. There was hope that we would get rid of the problem, but it has resurfaced. So we really need to put our thinking hats on and move ahead. So it's not a all of government approach. It's a all of society approach which needs to be taken. The government needs to put its act together. The bureaucracy, as I say, in a positive way, needs to ask itself where are the shortcomings? What are we doing? Why aren't we giving the people who put us in office, such a raw deal? And the people need to stand up and ask, what is wrong? Why aren't we being serviced and provided the quality of care which is part of the constitutional rights of every Fijian?
Now, why can't Fiji have state-of-the-art medical facilities? Is it all about money?
Yeah, it's just probably money, but I think the will has to be there. I think we got to have a will, and there will be a way. So you got a problem. My simple thinking is, you got a problem, find a solution. So nobody's looking for a solution. What they're doing is putting band-aid on it on a daily basis, and it's just getting worse and worse.
So the Band-Aid solution is at play.
So
Okay.
People need to think. Everybody needs to think.
Okay, Dr. Sharma, now in a speech on the occasion of the commissioning of the CWM hospital projects on 25th April 2014, you said the system was fragile. There have been obviously upgrades, presumably, in the last 8 years or so. I will seek your pardon. I'm going to ask you some quick fire questions, if I may, to see whether these machines, technology, whether they've been implemented, whether they are functional at the time of commissioning, and whether they are still functional or just kaput. So quick fire questions. Are you ready?
Yes.
Okay. Mammogram, working or not?
No.
In existence or not?
It is present, but it's broken down
Okay.
and not repaired.
Okay, CT, computerized tomography, that is the CAT scan, working or not?
Yes, currently working. It's been having periods of being broken down, but then, sort of working at present. It should be working 7 days a week, 24 hours a day. It's working 2 days a week.
MRI available, working or not?
Yes, MRI is working.
Ultrasound, ECG, cardiac echo services was being developed. Has it been operating?
This is working, but all the equipment is donated equipment thanks to Dr. Vijay Kapadia and his colleagues and the Rotary Club, Rotary International Fiji.
Non-invasive cardiac assessment, angiography, stents, valvoplasty, pacemaker services. Are these available and
Yes,
operational?
yes,
Okay. Open cardiac surgery was being undertaken at the CWM in Lautoka. Was this so, and is this still available?
it was, but with the termination of the Indian Sahedri group um and no further contracts from anybody else, it has ceased.
200 beds were to be commissioned together with additional delivery suites and operating theaters by 2014-2015. Was this achieved?
No, they've run out
Okay.
of money. They've run out of money. The foundation's sort of just sitting there. The groundwork's been done. Nothing has followed up.
The liquid cytology analyzer, with the ability to screen 50,000 pap smears, was this
Yes,
ever commissioned, and is this still available?
yes, it's working.
Well, that's a good news. Urology clinic with modern lithotripta, is it available? Is it
Yes,
functional?
working.
Well, some things are working, some things are not. Well, on a plus side, thank God for those things that's working. You are watching Sashi Singh's Talking Point, and our chief guest this afternoon is Dr. Neil Sharma, a medical practitioner and former Minister for Health in Fiji. Please take a moment and like and follow the SSTP page so that you may receive instant notifications for all posts and interviews on SSTP. Not long to go, Doctor. Um, Now, Professor Biman Prasad of the NFP has been on record as saying that the last 7 to 8 years has been the worst period of health services delivery under the Fiji First government. Even the Attorney General and Minister for Economy, on his road trip around the country this week, has said that he agrees that hospital services in the country needs improvement. This came about from the Attorney General when a man raised concerns regarding the Singatoka Hospital during the budget consultation in Kulu Kulu, Singatoka. The man said that the Singatoka Hospital is pathetic, and just recently his wife almost died because there was no injection for asthma at the hospital. Dr. Sharma, how did things get so bad in Fiji?
I agree with both the two gentlemen on their views, and the system has fallen apart. As I said, I have said, and I continue to say that there needs to be adequate executive oversight, meaning the government, the state, the minister must see to how his system is working, and the permanent secretary and his directors and his advisors, the divisional, subdivisional officers must work in tandem, and problems need to be identified and brought up, discussed, financed, and endorsed. So somewhere along the line, somebody's not doing the work. In my experience, there was a gap between what was discussed at the head office, at the director level, and what was happening at the divisional level. There's a disconnect out there, and as a result, you find that the services aren't coming or not being delivered adequately, and people just taking their sweet time. And even when it goes up to sort of the supply chain issues, these need to be identified. We need to know exactly what is needed where. You just cannot continue as is. The population changing, the demography is changing. The demographics is changing. So what happens is, if you don't address these things, you will never get anywhere, man.
It just boggles one's mind to hear that there's a disconnect. And if there's a disconnect between the whole chain, uh, people are suffering. It's just amazing that somebody in power, somebody in command can't put a finger on the pulse and say, this is the problem, let's do it. Now, where will the money come from to fix all this mess that the health service finds itself in?
Um, if you look at it prophetically or philosophically, you look at COVID, the billions of dollars which surfaced to address research and the delivery of vaccines in the developed country, the vaccine donation, the vaccine diplomacy, all worked to the benefit of the common man. For the countries, for the leaders to provide, some protection for the people. You look at Ukraine today. Look at the liberal world providing support to the Ukrainians, where you have a huge humanitarian crisis. So there's money around. There's lots of agencies, but we need to be able to write proposals. We need to be able to communicate. You need to be able to talk to the philanthropic organizations, the to UN organizations, and be able to source these sort of funding. If you're not going to fix it, it's not a solution, because you've got to fix it. Whether you do it in phases or in portions, or you do it in some way, but the whole system is collapsing. We are overwhelmed with human problems. If you take away humanity's health, how will they function economically? How will they be able to cater for their families? And that is the major problem in Fiji at present. The husbands are dying early. The women are struggling to send children to school and to educate the children. But we are caught up in a sort of a whirlwind where we're not moving ahead. So somebody's got to make some hard decisions. It has to come collectively, and that collective spirit is absent. Nobody's discussing anything. Everybody's fearful that their position would be adversely affected if they speak up. So in the bureaucracy, there's everybody's sort of sitting quietly and stalling and probably waiting for the 55 years retirement. But I don't know what the retirement will be without the F and PF.
Well, like I said, there's so much of revelations from you this afternoon regarding the health sector in Fiji. Again, it just boggles the mind that, for instance, the Minister for Economy can go all around the country selling the mini budget, and yet one would imagine that the Minister for Health would be on the front foot, trying to fight for funds, trying to organize funds, trying to have an effective health system in Fiji. Question to you now, Dr. Sharma. Can the health sector be improved?
There's no question. It has to be fixed. It has to be fixed. That's all. If you don't fix the system, what are we going to do? Are we going to go back to the Ojha? Or are we going to go back to the, practitioner of witchcraft?
Mhm.
I mean, we've gone beyond that stage now. And really, if the system's not working for us, then we need to rethink our, re-strategize our position and take it forward. Again, go back to my statement: problem, solution.
Yes, sure. Um, Now, are there qualified medical personnel in Fiji to raise the standards of healthcare in the country? Or do you think Fiji has to rely on overseas personnel, overseas assistance?
I think we have enough people to be able to run the system. They are cognizant of what is the specific problem in the area, so you don't need to bring in an expert and train him and groom him for 6 months, and he gets frustrated and he brings in a Western model, and the model doesn't work. So that is one angle. Sometimes you need support from experts. What we need to do is to train our people, put in place a program of educating our locals, taking them up, giving them international exposure, and then ensuring that they come back and serve our people, because that has to take place long term. And I see no problems that there is expertise. There's great amount of expertise available to our common problems, and we need to be able to address that successfully.
Now, the Ministry of Health and Medical Services is allocated $403.3 million dollars in the 2021-2022 budget. Where do you think this money should be spent on? In other words, how does one prioritize the needs for improvement in the health service?
I think that's a decision which has to be made collectively by the Ministry of Health. A practical problem one faces is that submissions are made by the accounting people, being advised by some of the directors in the Ministry of Health. But there has to be a wide consultation on what is needed, what we have, what are the priorities, and we need a new way of thinking and putting it together. So that means, we need to go back to look at the six building blocks of health. We talked about leadership and governance. We talked about manpower. We talked about service delivery. We talked about pharmaceutical supplies, funding, and the IT. So those were the six important building blocks. So all that has to be put together. But I think the primary problem is funding, health financing. If you get the health financing right, it's just like in your own home. If you have X number of dollars, you know that this is going to go for food, water, your utilities, your children's fare, your fuel. So you're going to apportion a certain amount, and then we need to be able to reapportion that. And at a macro level, that needs to be done. And unless we do that and look at what are the priority areas and work around it. But, as I said, funding is important, and ongoing training and education is very important to retain our manpower. And at the same time, we need to move ahead with issues like supply chain, developing our IT, which is kind of getting very old, and looking at our service programs. I mean, you look at NCD today. 83% of premature deaths in Fiji due to NCDs: cardiac, cancer, mental health, diabetes. We don't have a NCD policy. We've been running without a policy for the last 6 years, 6 or 7 years. We had put something together in my time, but it got diluted down to a wellness policy. And that wellness policy basically divorces health from the oversight, financing, and monitoring and evaluation of the program. So if the Ministry of Health is not taking a leading role, it's left it to the community to look after themselves, then it is state's responsibility to refocus.
Well said. Very well said. As we head towards the home stretch, Dr. Sharma, you resigned from the Fiji First government in April 2015.
Can't hear you.
I said you resigned from the Fiji First government in April 2015. Well, my side is working. Must be your side. Something's happened. I can hear you.
Okay,
Yes.
fine. Sort it
All
out.
right. All right. So I'll start that question again. You resigned from the Fiji First government in April of 2015, and you touched on unfinished business. Do you think you have unfinished business?
If you look at the delivery of health, yes, there is unfinished business. There's a lot more, not only unfinished business, there's new business to address. It's been compounded further, so we have to go back a couple of steps more and then bring it to pace.
Okay, well, since you have unfinished business, will we see you contesting the next general election?
Sashi, I'm getting on to 67, and
That's young. That's very young.
I think sort of coming into the firing line, whatever you do, general public sort of sometimes is happy with what you're doing, sometimes they aren't. They if there was a description, I don't think I cut out as a good politician, because politicians aren't professionals. Unfortunately, they go in with a good heart, they become corrupt at the end of the day. And I think if you had to describe me, you'd call me a health strategist. So I'm happy to help the government address these issues, but I think I would probably prefer to go and complete my book, my
Yes.
biography. I've I've talked to you about this. I've
Yes.
found the name, the
And I'll keep that
unlighted
name a
pearl.
secret. I'll
No,
keep
you
that
don't
name
need
a
to keep it a secret. It is the Unknighted Sir. So
Yes,
I
that's
think I will
the
go and
title.
write the book.
That's the title of the book, The Unknighted Sir. Um, Dr. Sharma, all the best with your book. Now, as we draw to a close, uh, talking about the health issue and all its concerns that we've got in Fiji, what is your message to the people of Fiji?
First and foremost, please look after your health. You know, the social determinants of health. You know, where you're born, how you were raised, where you school, your education, everything matters. So for the parents, I think it's important. We all strive to give our children a better future. So try and do that. Now, at the same time, you have the power in your hands to make the choices. We are in very difficult times. It's not only health which is being affected, the economy is being affected, your social relations are being affected, your children's education is being affected. So you must think right, and you need to stand up and do the right thing when it is your time to make your decisions, especially in an election year.
Well said. Now, finally, this afternoon, you've given us insight on the medical situation in Fiji, the healthcare situation. You've given us some insight of the machinations within the Fiji First Party. We've shared some very emotional moments of your personal sacrifices and your personal loss. What is your reaction to the SST program that you've just participated in?
Thank you very much. It is something I wish others had thought about it, or you had thought about it earlier. But as we all mature in our lives, that's a point in time comes when we need to address issues. And I think in some ways, this program is a good closure for me. A closure
Mhm.
in the sense that we have been through difficult times. As a profession, as a leader, as a family man. But airing this helps me come to terms with myself. But I am concerned about my progeny, my children. I sometimes wonder that I hope they don't get adversely affected. But every event in our life is a challenge, and we've got to face up to that. They are not everybody thinks equally, and I thank you for this program because it did provide me closure as far as my personal losses were concerned, and it's not an easy undertaking to find yourself in the predicament you find yourself in when you lose your partner of over 40 years.
It has been said that an educated, healthy, and confident nation is harder to govern. Again, I say that an educated, healthy, and confident nation is harder to govern. I just hope that the people of Fiji are confident enough to make educated choices when it comes to their health and what their expectations are from the health service providers and their government. I say to the people of Fiji, speak up and be heard. Demand answers from your government. They are supposed to be your servants. Innocent people are dying because of lack of proper and adequate health care in the country. Dr. Neil Sharma, thank you very much for being chief guest in Sashi Singh's talking point this afternoon. I sincerely appreciate you taking part and being so forthright in your responses to my questions this afternoon. I'm very, very pleased that we've been able to share some interesting facts with the listening audience. Thank you, sir.
Thank you.
Now, thank you very much, and Vinaka Bakalevu to you. Wishing you a very blessed Sunday. And folks, don't go yet because I have yet to reveal next week's chief guest. I thank all those viewers who have taken time to provide their positive feedback with regards to the questions. Well, that is all for episode 13 this week. A big thank you to my regular contributor, Nikhil Singh, for his input in the program today. To my SSTP team, a big thank you to you as well. And like I said to all you viewers, thank you, Vinaka Vakalevu. Well, as we know, the Minister for Economy will hand down the mini budget this coming Thursday at 7:30 p.m. Fiji time. Therefore, in next week's program, we must, and we will analyze the mini budget and look at the good, the bad, and the very ugly aspects of the budget. Therefore, next week, our chief guest on Sashi Singh's Talking Point will be Dr. Nilesh Gounder, Senior Lecturer in Economics at the University of the South Pacific. If you have any questions for Dr. Nilesh Gounder on aspects of the mini budget, you can privately message me on the SSTP page. Please like and follow the SSTP page so that you can get instant notifications of the posts. And with that, I wish you all a very safe and blessed week. In closing, I leave you with this quote from Maximilian Robespierre, who said, "The secret of freedom lies in educating people, whereas the secret of tyranny is in keeping them ignorant." I'll repeat that. The secret of freedom lies in educating people, whereas the secret of tyranny is in keeping them ignorant. Wake up, people. Be educated with your choices, and don't let anyone fool you or make you believe that you are ignorant. Thank you once again for being part of episode 13 of Sashi Singh's Talking Point. I am Sashi Singh, wishing you all a very good afternoon. Goodbye, namaste, and ni samode. Goodbye, world.